everybody. Today I'd like to talk to you about canine diabetes and especially my personal story with my dog Sergi. So this is Sergi. He's a 7-year-old Shorgie, which is 3/4 Corgi and 1/4 Shih Tzu, and he was diagnosed just over a year ago at 6 years old. So what is canine diabetes? Diabetes mellitus is a disease of the pancreas, which is a vital organ near the stomach, and the pancreas creates two significant populations of cells. One creates the enzymes, or the cells that produces the enzymes necessary for proper digestion, and the other group, called beta cells, produces the hormone insulin. So diabetes occurs in your dog when its body creates too little insulin, stops producing it completely, or has an abnormal response to the insulin. And so this type of diabetes is usually found in dogs ages 5 and up. And so what does this mean? When your dog eats food, it's taking in carbohydrates, which is then broken down into simple sugars, which include glucose. So glucose is then absorbed from the intestines into the blood, which is then carried throughout the body in cells throughout the body. And so insulin is really important for our bodies and for our dogs' bodies because it is required for the transfer of glucose from the blood to the cells. And so when you have too little insulin available, the glucose can't enter into the cells, and this leads to a buildup in glucose in high concentrations within the bloodstream, and this creates hyperglycemia. This then leads to, the buildup leads to not enough energy going into the cells for the cells to function normally, and so this is called cell starvation. And so long-term results from this is that your dog is going to lose weight, regardless of eating the proper amount of food or even more, because it has an increased appetite. And then through the buildup of glucose in the blood, the glucose is going to spill from the blood into the urine, and this draws on a lot of water, and so your dog is going to have an increased thirst and urination, and then also long term your dog is going to form cataracts and cloudy eyes. So this is a blood glucose level chart that just shows that a normal blood glucose is 65 milligrams per deciliter to 220 milligrams per deciliter, and anything above that is going to be called hypertension. And so long-term effects of hypertension is when you are then going to see your dog with increased thirst and increased urination. And then if it holds that hypertension above 220 milligrams per deciliter for a long period of time, that's when your dog is going to become lethargic, and it's going to have those dopey eyes where they're kind of glazed over, and you're going to start seeing cataracts being formed.
Now, don't you mean hyperglycemia?
Yeah.
You're saying hypertension.
Oh shoot, I'm so sorry.
That's okay.
Hyperglycemia. I'm sorry.
No problem.
And then anything below the 65 milligrams per deciliter is going to be your hypoglycemia. And so your hyperglycemia is found a lot more common in dogs, and it's also diagnosed a lot easier. It's because your hypoglycemia, the symptoms either don't show up or they're very hard to diagnose and very hard to see within your dog. So your dog is just getting sick, and it's unclear what's causing that. And so what were Sergi's symptoms? Sergi had excessive thirst and urination, and so that was our big key for us, because as a 6-year-old dog who hadn't had accidents since we first got him, he started having accidents, and he was drinking the whole bowl of water instead of just little amounts. And so that was a big sign for us. And then he also had the cloudy eyes and became very lethargic. So he didn't have the happy puppy eyes and just wasn't as active as he normally was. And then he also had a huge weight fluctuation. So he lost a lot of weight and then gained a lot of weight. So you can see in this picture here, he's a little chunky monkey and wasn't the appropriate weight that he should be. And then when we took him into the vet to finally figure out what was going on with him, he had a blood sugar level of 118 and a glucose level of 483 milligrams per deciliter, when a normal level is from 70 to 138. So that was a very clear indication that, yes, he has diabetes. And so from there, what our next steps were to start giving him insulin twice a day, every 12 hours. So we give it to him at 7 and 7. And then when we first diagnosed him, we had checkups every 3 to 6 months until we got it under control. And in our 3-month checkup, we needed to increase our insulin from 6 to 9 milliliters, just because the 6 milliliters wasn't covering him throughout the day and giving him the proper control over his glucose that he needed. And from all this, we were able to get back down to a healthy weight. So he went from 36 pounds back down to 29 pounds. So he's a happy, healthy pup. And I thought this was all really interesting because as we were talking to our vet and deciding our next steps and what to do about his disease, she basically told us, you know, I can give you a prescription that you can go refill whenever you need, but that's going to be a lot more expensive than if you just go to Walmart and get the generic over the counter that doesn't need a prescription. And so we thought that was really interesting just because we had heard a lot of people say, you know, they're paying $80 per vial, so like $80 every 2 weeks or so just to treat their animal, which is really expensive. And so being able to use that generic that gets the same coverage and the same effects that's what we do, and we're having good results and good coverage and stability with him. And then also we were recommended, and we use needles once to reduce the likelihood of abscesses. And then of course we're using that positive enforcement and practice as we're giving these shots, just because I know I wouldn't like to get stuck with the needle twice a day, and I'm sure you don't either. And so whenever, it's actually really interesting because he knows when it's time for insulin, and so he'll like come over and just sit there and look at you and get happy, and you're like, oh, you want insulin? And he wags his tail and gets all excited. So he's a little insulin addict. But so whenever we get ready to give him insulin and everything, you know, you get really cheerful and use that voice with him. And then we use cheese or some type of or meat, some type of treat for him. And then we either have him nibbling on it as we stick him in the neck and inject him with the insulin, or we get him, and it's a really small needle, so it's hard for him to feel that, I'm sure. I don't know because I'm not him, but it's really small, so just a little stick, and then we give him cheese afterwards and positive reinforcement, so it's more of a happy event instead of something that he gets to dread every day. And so now he's living as a happy, healthy little puppy, and we make sure to keep him active, so he gets to run around on the farm and chase the cows sometimes. And he snuggles a lot and messes around with us and goes on lots of road trips. So just making sure he has that happy and healthy balance and the timeliness for his shots and everything. So these were my resources.
And there you go.
So thank you.
So we'll give her a round of applause. Let's remember that. Very good. And then, anybody have any questions or comments? Because then I'll let you point to people. There's somebody over here.
Yeah.
I was just curious, did you have to like change his dog food or anything?
Now repeat the question too.
So the question is, did we have to change his dog food? And we were feeding him a fairly good diet beforehand. And so we were able to stick with that. If anything, at one point we did switch to a healthier dog food. It was kind of complicated because he lived with my brother last year at college, so he was a college puppy going through all this. So as responsible as a 21-year-old college frat boy could be. But he did feed him on good food, but then when he went home, he went back to the original. So we didn't have to change it up too much.
Anybody else comments or questions? I'll let you point.
Okay.
What are the costs associated with, I'd say, treating a dog diabetes for a year or so?
Oh,
That's
so
a good question.
that
What
is-
it costs for a year?
that is a really good question. I should have an accurate number about it, but we're slightly different with it just because he does move around so much, and so we have some property and then our home, and then when he's with my brother, and so we just always make sure to have insulin
I see.
wherever he could be. But usually we have to go get a new vial, I'd say every 3 weeks.
Every
That's-
3 weeks. Okay.
But that's also like, I don't know how accurate that is just because I'm not
No, I
home as
understand,
much,
yeah.
and he was diagnosed right before I went to college last year in August.
Right.
But between, it's hard to guess that just because like when he's at school and then he goes home for a little bit, so then that insulin won't be used for like another week or so because he'll be moving. But
And that's in a refrigerator, right?
yes, it's in a refrigerator. And with insulin, it's really important to keep it refrigerated and like to follow the guidelines just because we don't want it to get inactive. So if we have like a dinner or if we have something to go out that we know that like we can't be at home at 7, we'll bring him with us and then bring like a little cooler and ice it down with us. And so like it has had its complications
Oh,
with
yeah.
it just because as like a responsible dog owner, we have to be responsible for this disease and to make sure that we're home like
Mhm.
at 7 and 7. And so in the past year, I mean, we give it to them within 10, 15 minutes, like if not exact. So we all have like alarms on our phones.
And you said 9 mils, you went from 6 mils to 9 mils,
Mhm.
the dose, yeah.
Yeah.
And you saw how big is the bottle? Is it, it's about $25. I'm just curious how many mils are in there, you know?
It's big.
Yeah, yeah, so,
It's fine.
and then what size needle? Because you could always, when you say size needle, you could always say what gauge. Do you remember what gauge?
No,
Probably not,
I'm
yeah.
sorry.
It's probably
It's
like,
really
Oh,
small.
just
The needle's,
tuberculin syringe, whatever.
Yeah.
you
the
know,
needle is
syringes.
probably like half the size of your pinky nail.
oh, yeah, yeah.
It's really,
It's-
really small.
Usually, if you're not familiar with needles, the higher the number, the smaller the needle, right? Now, like, she's maybe using 25 gauge or something. And like when I used to work with large bores, for example,
Mhm.
I work with needles that you've never seen. We had to actually have them custom made, like 10 gauge. You know, nobody ever uses a 10 gauge needle, but we were puncturing like the jugular vein in big bores, and the needles had to be this long, just to get through the jowl, you know. Anybody else, comments or questions? Yeah, there were.
Parker, yeah.
During the presentation, you said you injected the neck. Is there a reason you choose that injection site?
Okay, so,
So
and
yeah.
I know what I'll do, I'll repeat the questions. The question
I'm
was,
sorry.
you inject in the neck, because remember, I'm trying to
Yeah.
make sure this is important. And why did you use that site?
Mhm.
And in the neck, and she's gonna tell us, you could either do sub-Q or intramuscular, so I wanna make sure she tells us what.
Yep. So we just followed the directions of the vet. So we do it sub-Q on the back of the necks because there's lots of like neck skin there. So you usually pull up and then poke them and give it to them there.
Make a little tent and then,
Mhm.
okay, so that is a sub-Q in the neck,
Yep.
and it's a good site, there's a lot you can
Uh-huh.
move, right? And if you
Yes.
use a small needle,
Mhm. And so that's when I said that we reuse the needles, like we only use it once to decrease the likelihood of abscesses and everything. So with that, we also kind of move him around. So like he has a pretty thick neck because he's a corgi, and so we have a couple inches of room to kind of move around. So it's never like the same injection site each time, and so just to like decrease that likelihood as well there.
good point. Because some things you inject can be very irritating
Mm-hmm.
and cause problems.
Mm-hmm.
Other comments or questions about dogs? So it's a commitment, and here's the other thing about when glands make too little or too much of something, in this case it might be not enough insulin. So for animals and keeping them healthy, it's easier to give an animal a replacement substance rather than have an animal make too much of something. That's harder to deal with. When an animal is like making too much of something, you can't really get rid of it, And the best example would be like cats and hyperthyroidism. It's a problem because you either have to get some of the thyroid out, you can destroy it with radiation. It's a much more complicated thing than like dogs. If they have hypothyroidism, you give them some thyroid hormone to supplement. So it's, in general, it's easier to manage than something that's sky high, and then yeah. Okay, very good, excellent. I'm gonna walk over here and shut it off.